Imagine showing up to your therapy appointment and being forced to conduct that therapy session in an open cubicle in an office. This is the reality that Donald Trump apparently wants. My name is Brittany Page, and this is the Page Perspective. When I read this new reporting about the impact of Donald Trump and Elon Musk and Doge slashing government funding for mental health treatment, I couldn't help but think about all of the times we've seen Republicans step to the microphone in the aftermath of whatever mass shooting has recently taken place, telling us the issue is not, in fact, the ease of access to weapons in this country, but mental health. It's the mental health treatment, they always say. But never do we see anything done about what they claim is the central problem, right? If you actually believed that, you'd be lining up to boost the funding for mental health treatment, right? Well, this is yet another example that they don't actually believe what they say. Judd Lugham with Popular Information, an incredible independent journalist that you definitely need to follow, he recently published this on his newsletter, quote, Veterans Administration therapists forced to provide mental health counseling in open cubicles. And you may or may not know that I'm a licensed therapist. I have a Master of Science in Clinical Psychology. This is my field, my background. So when I read this, I thought back on my work history and the number of times I've worked in community or county health clinics where we needed, like a noise machine outside the door to give more privacy and security to our clients in our small little underfunded clinics. And I thought about what it would be like to arrive to work after a billionaire wreaking havoc on my agency, where I'm now being told that I need to provide therapy in an open cubicle where I'm forced to make a choice between my own personal livelihood and ability to pay my bills and make a living and what is best for my client. It's disgusting on so many levels, and Judd really makes that clear. Quote, as part of the Trump administration's frenzied push to end remote work arrangements for federal government workers, the Veterans Administration, VA, is forcing therapists to provide mental health counseling in open cubicles. The therapists, who work for a network of clinical resource hubs operated by the VA, are now required to work in person, but the facilities do not have enough private offices. The VA therapists are deeply concerned about the ethics and legality of conducting therapy sessions from a cubicle, according to internal VA chat logs obtained by Popular Information. Judd goes on to make clear that this is because of the return to office push that we've seen so much of from Donald Trump, Elon Musk, but conservatives as a whole. They believe being in the office creates more productivity, despite the fact that employees benefited from the flexibility that came with remote work. And in this very specific area of mental health care for veterans benefited from remote work in that it allowed their therapists the privacy needed to ensure confidentiality, which is an essential, critical part of providing therapy. So these therapists were forced back into the office only to be provided nothing in the form of allowing them to actually do their job effectively, safely, and in keeping with the standards set by our profession and licensing boards. Reading again from Popular Information. Quote, in an internal chat among clinical resource hub staff, one therapist reported they were, quote, relocated to a VA call center cubicle space. According to the therapist, quote, non-mental health VA staff around my cubicle can hear my sessions. The therapist said they were, quote, worried about issues of licensure and ethics code violations related to confidentiality. Another therapist reported that they are being told by leadership that, quote, screen protectors, a white noise machine, and a headset is sufficient to ensure patient privacy in a large bullpen of cubicles. The therapist was skeptical and reported that, quote, these items are not always available. A third therapist suggested the cubicle locations put the therapists in violation of federal law. Quote, the criminal and civil penalties for violating HIPAA, the Health Insurance Portability and Accountability Act, are sobering, the therapist said. HIPAA establishes legal standards to protect against the unnecessary disclosure of patient health information. This is unacceptable on every level. And because I'm a therapist, I've mostly focused on the therapist perspective here, but what about the clients? I've also been a client in therapy. All good therapists should have that experience, right? You're watching this right now. Maybe you've also been a client in therapy, and I'd be curious if you have been in therapy, how you see this. Leave a comment below and tell me. Imagine going for a session and your therapist is in an open cubicle and you're trying to talk about personal things, the personal things that someone discusses in therapy, your greatest fears, your greatest challenges, your most profound traumas, your failure, flaws, worries, where other people might hear you. On the most fundamental level, this interferes with the efficacy of therapy. Therapy is most effective when the therapeutic alliance, the therapeutic relationship between therapist and client is strong, and that is often built on trust and mutual respect and understanding that the therapist knows what they're doing, sure, but also that the physical space where the therapy is taking place is safe and private and protected. Therapy that actually helps people who are suffering cannot take place in an open cubicle. Not only is it not effective, but it goes against the ethical and legal standards set for therapists. Of course, this isn't the only aspect of the government slashing that is impacting healthcare for veterans, and Judd Lugham covers that very well in his newsletter, which I will, of course, link in the description. But I want to also talk about another related area here from this reporting in the New York Times. Quote, federal agency dedicated to mental illness and addiction faces huge cuts. The Substance Abuse and Mental Health Services Administration, SAMHSA, has already closed offices and could see staff numbers reduced by 50%. So the Trump administration is wanting to cut another agency, providing critical, essential mental health and addiction treatment, while at the same time, Donald Trump continues to talk about the dangers of fentanyl. And while we're still seeing far too many overdose deaths, and while people are still struggling to access mental health care treatment, yes, it seems like the ideal time to cut essential funding and staff for SAMHSA. Reading from the New York Times, quote, with just under 900 employees and a budget of $7.2 billion for large state grants and individual nonprofits that address addiction and mental illness, SAMHSA is relatively small, but it addresses two of the nation's most urgent health problems and has generally had bipartisan support. The agency's broad mandate includes overseeing 988, the National Suicide and Crisis Lifeline, which fields millions of calls through state offices, regulating outpatient clinics that dispense opioid treatment drugs such as methadone, directing funds to drug courts, also called treatment courts, and producing nationwide annual surveys of substance use and mental health issues. It provides best practice training and resources for hundreds of nonprofits and state agencies and helps establish centers that provide opioid addiction prevention, treatment, and social services. It is also a federal watchdog that closely monitors the spending of taxpayer-funded grants for mental health and addiction. Quote, cutting SAMHSA employees without understanding the impact is extremely dangerous, given the behavioral health crises impacting every corner of our nation. Representatives Paul D. Tonko of New York and Andrea Salinas of Oregon wrote in a letter to Mr. Kennedy, signed by 57 Democratic House members. Reductions in staff, they argued, could lead to a surge in relapse rates, a strain on the healthcare system, and poorer health outcomes overall. You've heard me say mental health is political, therapy is political, and this is what I mean. Therapists and social workers often find themselves in this place where they are trying to be helpful. They're trying to do what is right by their clients, where they're trying to save lives, but they're oftentimes stuck fighting against systemic failures that make progress more difficult for their clients. We should, all of us, want to ensure that therapists have everything they need to be successful because their job is so essential. And I know I'm biased, but it's true. I know so many people, I have so many close friends who are therapists who I am so lucky to know because every day they are out here showing up to schools, showing up to clinics, showing up to courtrooms, showing up to advocate, support, and help people who are at their lowest, who feel like giving up. And even when they feel the system is against them, they still show up and fight like hell for their clients. They are doing more than Elon Musk ever will for society, for the betterment of society. So there's a lot to worry about and advocate for right now, but we can't forget about this because it impacts us all. What do you think? Call and tell me in a fewer than 3-minute voicemail at 202-656-1509 or send an email to idoubt@dollamore.com. You can also support my work by becoming a channel member for as little as $1.99 a month by clicking the join button below or by going to patreon.com/idoubtitpodcast. I am so excited for some new things to come this year, even in the midst of the chaos. I appreciate you being here. I appreciate you leaving your thoughts in the comments below. Take care, and I will see you next time.